Headaches are a common and frustrating source of chronic pain, often leading people to reach for the medicine bottle at the first sign of discomfort. But what if there's a better way to take control? Imagine breaking free from the cycle of chronic headaches and finding lasting relief without relying on pills. Because there are a number of evidence based strategies that can help you manage headaches in a natural and effective way. So, in this video, we'll be diving into some really effective techniques and treatments that can help you reduce the frequency and intensity of your headaches. First, it's important to understand that both tension type and cervicogenic headaches often stem from poor posture. So, one of the first things you should focus on for both types of headaches is improving your posture. Poor posture, such as prolonged slouching or forward head posture, places excessive strain on the joints and muscles in the neck and upper back, which can either directly trigger headache pain or worsen underlying issues. For tension type headaches, poor posture can lead to muscle strain. For cervicogenic headaches, it can increase the stress on the upper cervical joints and upper thoracic joints. The solution for both is the same. Prioritizing good posture throughout the day can reduce strain on the muscles and joints in the neck, helping alleviate headache pain. One of my favorite postural fixes is a simple lumbar roll. This small adjustment not only supports your lower back, but also encourages better spinal alignment all the way up your neck, preventing that head from coming forward. This helps reduce strain on the muscles on your upper neck and back, which is key for both tension type and cervicogenic headaches. And when you're using your computer or phone, try not to look down too much. Did you know that the average human head weighs about 10 to 12 pounds? But when you look down at a 45-degree angle, it increases to about 35 pounds of pressure on your neck. And if you're looking all the way down, it's about 50 pounds. No wonder why your neck starts to ache. So simply raising that device can drastically reduce the load and make a world of difference for your neck. The more it's eye level, the better. Another effective treatment for both cervicogenic and tension type headaches is soft tissue mobilizations. For both types, the muscles in the neck and upper back and shoulders often become spasmed due to being overworked, contributing to headache pain. Techniques like deep tissue massage and dry needling can be very helpful in relaxing painful muscles, improving circulation, and reducing overall tension. And when it comes to headache symptoms, certain muscles tend to be the biggest culprits. Research commonly associates referred headache pain from muscles like the suboccipitals, sternocleidomastoid, and upper trapezius muscles, which are known to have a clear and reproducible pattern of headache-related referral. Other muscles like the levator scapula and scalenes also play a role in headache symptoms. While they may not directly cause headaches, tightness or trigger points in these muscles can contribute to overall neck tension and poor posture, which often aggravates headaches. Also, the temporalis and masseter muscles, commonly linked to jaw tension or temporomandibular dysfunction, are significant contributors to tension headaches, especially if you clench your jaw or grind your teeth. Muscles like the splenius capitis and cervicis, located along the back of the neck, and the pectoralis minor in the chest, may not directly trigger headaches, but can indirectly worsen symptoms by promoting forward head posture and rounded shoulders. This can create a domino effect that exacerbates both tension type and cervicogenic headaches. Another common source of pain is joint stiffness, especially when it comes to cervicogenic headaches. Here, the key issue often lies in the joint dysfunction in the neck, especially in the upper cervical spine, around the C1 to C3 levels. This is where manual therapy like joint mobilizations and manipulations can make a big difference. From a movement standpoint, the joints in your neck need to glide and roll smoothly for everything to move properly and for loads to be distributed evenly. When these joints get stiff or restricted, it throws everything off. Mobilizations and manipulations can help restore normal motion and take some of the strain off surrounding joints and muscles. This not only improves mobility, but also helps your neck handle daily stresses more effectively. These techniques can also alleviate pain. Inside your joints, you have little sensors called mechanoreceptors that send signals to your brain. Mobilizations and manipulations activate these sensors, which can essentially turn down the volume on the pain signal. They can also help relax tight muscles around the area and calm down the nervous system, which is especially helpful if your pain has been hanging around for a while. So effectively, these manual therapy techniques are like hitting the reset button for your neck. While there is more evidence for the use of mobilization and manipulation for the management of cervicogenic headaches, these techniques might still be helpful for those with tension type headaches as well. Improving mobility can help with posture and pain and take some pressure off those overworked muscles. But stiff joints and muscle spasms are often just one part of the puzzle. Weakness in the postural muscles can also be a significant contributor to chronic headaches. And when it comes to finding long-term relief, you often aren't going to be able to just massage or stretch your way out of this problem. If your muscles aren't strong enough to keep your body upright for long periods, the strain will keep building up, and the headaches will keep coming back. This is where restoring dynamic stability comes in. It helps reduce the ongoing stress on your neck over time. One area that deserves special attention is the deep neck flexors, muscles like the longus colli and longus capitis. These are stabilizers of the neck, the ones that help you maintain a good posture and proper alignment. Think of them like the core muscles of the neck, similar to how we think of the abdominal muscles to help with back pain. If these muscles are weak, it leads to instability, which puts extra strain on the surrounding muscles and joints, setting the stage for more headaches. Weak deep neck flexor muscles are a common problem in both tension type and cervicogenic headaches. Strengthening them can improve neck stability, reduce the load on other muscles, and most importantly, help break the cycle of pain. By addressing this weakness, you're not just managing symptoms, you're fixing the root cause to prevent future headaches. But it's not just about the neck. Our bodies tend to do some pretty funky things when we're in pain. Often one area becomes overactive and another area becomes underactive due to compensations. In the case of chronic headaches, this often means weakness developing a little further down the chain, particularly in the periscapular muscles, like the lower trapezius, rhomboids, and serratus anterior. These muscles are essential for stabilizing the shoulder blades and maintaining a neutral spine. When they're weak in these areas, it can throw off your body's ability to maintain a more neutral posture and increase strain on the neck and upper back, setting the stage for both tension type and cervicogenic headaches. Now, no video about headache treatment would be complete without addressing some key lifestyle factors that influence chronic headaches. Because let's face it, our bodies are complex systems, and pain is not always as straightforward as it seems. It's influenced by a whole range of factors, some occurring directly in your neck, and others a bit more between the ears. For those with chronic headaches, stress plays a huge role. When we're stressed, our bodies activate the fight or flight response, triggering the release of stress hormones like cortisol and adrenaline. These hormones prepare our body for action. But they also increase muscle tension, particularly in the neck, shoulder, and jaw. Over time, this muscle strain builds up, leading to headaches. Stress can also make us more sensitive to pain by affecting the body's pain pathways, causing pain to be perceived more intensely. So stress management techniques like relaxation exercises, meditation, yoga, or breathing exercises can be very helpful. These activities help activate the body's relaxation response and reduce muscle tension. This way, you're not just addressing the muscles and joints directly involved, but also the emotional and neurological aspects of pain, leading to a more comprehensive approach to headache management. Managing headaches, whether tension type or cervicogenic, requires a holistic approach that addresses both the physical and emotional aspects of pain. By focusing on key strategies such as improving posture, mobilizing stiff muscles and joints, strengthening weak muscles, and managing stress, you can break free from the cycle of chronic headaches. These evidence-based techniques not only target the root causes of headache pain, but also promote long-term relief without relying on medication. Through consistent practice and awareness, you can regain control of your health and reduce the frequency and intensity of your headaches, leading to a more comfortable and pain-free life. If you found this video helpful, be sure to hit that like button to help it reach more people like you. And don't forget to stay tuned for our next episode, where we'll continue sharing essential information about your body, how it works, and what it needs to keep moving.